In the same way, you can see that the intercostal nerve supplies the skin of that area. And the same with 7 to 11 intercostal nerves supply the interior abdominal wall, right? And first lumbar and 7 to 12 intercostal nerve and first lumbar supplied your interior abdominal wall muscles and parietal peritoneum. Okay, so and these intercostal nerves also supply the chest area. So in that way, if you have disease in the thoracic wall, may be revealed as pain in your abdominal wall because of these dermatomes. Okay, this is important. Hope you get some idea. Okay, the next point is coronary heart disease and the intercostobrachial nerve. In coronary heart disease, pain is often referred along the intercostobrachial nerve, the medial side of the arm. Okay, and the next point is pneumothorax. Clinical notes: as a result of disease or injury, air can enter the pleural cavity from the lungs or through the chest wall. This condition is known as pneumothorax. And here is the point: inhaled foreign body. Inhaled foreign body. So inhaled foreign body, because the right bronchus is wider and more direct continuation of the trachea, foreign bodies tend to enter right instead of the left bronchus. From there, they usually pass into the middle or lower bronchi. So the right lobe is wider and more direct continuation. So foreign body here easily go. This is the point. Okay, so we are going towards the next clinical point, which is pain and lung disease. Lung tissue and visceral pleura are insensitive to pain and supplied by autonomic nerves devoid of pain sensitive nerve ending. Once lung disease crosses the pleural cavity to involve the parietal pleura, pain becomes a prominent feature because it is supplied by intercostal and phrenic nerves with pain sensitive nerve ending. So it's mean a lung tissue and visceral pleura are insensitive to pain, and when it involves the parietal pleura, the pain becomes the prominent feature because pain is carried by intercostal and phrenic nerves, so which have pain sensitive nerve endings. Okay, the next point is heart sound. This is important. You can see then past MCQs, there are so many MCQs related to the location of sounds. Where is aortic valve located? Okay, just start it. The heart makes two sounds, lub dub. The first sound is produced by the contraction of ventricles and closure of the tricuspid and mitral valve. Second shorter sound is produced by sharp closure of the aortic and pulmonary valves. Tricuspid valve is best heard over. Tricuspid valve is best heard over the right half, the lower end of the body of the sternum. The right half of the lower end of the body of sternum. And mitral valve is best heard over the apex beat at the level of fifth left intercostal space, approximately 3.5 inch or 9 centimeter from the midline. Pulmonary valve is best heard over the medial end of second left intercostal space. Medial end of the second left intercostal space. The aortic valve is best heard over the medial end of the second right intercostal space. So how to remember pulmonic valve and aortic valve? Aortic valve is second right intercostal space, and pulmonic valve is second left intercostal space, and mitral valve apex beat के level पे fifth left intercostal space, and tricuspid valve is over the right half of the lower end of the body of sternum. Okay, and the next point is failure of the conducting system of the heart. The AV bundle is the only route by which the cardiac impulse can AV bundle is the only route by which the cardiac impulse can separate from atria to ventricles. Failure of the AV bundle to conduct the normal impulse results in alteration in the rhythmic contraction of the ventricles, or if complete bundle block occurs, complete dissociation between atria and ventricle rates of contraction. So just read again. AV bundle, SA node, AV node, then AV bundle, then bundle right and left, bundle branches and Purkinje fibers. AV bundle is the only route by which the cardiac impulse can separate from atria to ventricles. Failure of the bundle to conduct the normal impulses result in alteration in the rhythmic contraction of the ventricle, or if complete bundle block occurs, complete dissociation between the atria and ventricle rates of contraction. Okay. The next point is coronary artery disease. Although the coronary artery disease have numerous anastomosis at the arteriolar level, they are essentially functional and arteries. A sudden block of one of the large branches of either coronary artery will usually lead to necrosis of the cardiac muscles in the vascular area, and often the patient dies. This is the reason they have pale in pop. Okay, so the next clinical point is cardiac pain. So what is clinical notes? Pain originated in the heart as a result of ischemia results in the stimulation of the sensory nerve endings in the myocardium. The afferent nerve fibers ascend to the central nervous system through the sympathetic trunk and enter the spinal cord through the upper fourth thoracic nerve. The pain varies considerably from severe crushing pain to nothing more than a mild discomfort. The pain is not felt in the heart but is referred to the skin area supplied by the corresponding spinal nerve. The skin area is supplied by the upper four intercostal nerves and by the intercostobrachial nerve, intercostobrachial nerve are therefore mainly affected. Just read it again. Pain originated in the heart as a result of ischemia, results in the stimulation of sensory nerve endings in the myocardium. The afferent nerve fibers ascend into the central nervous system through sympathetic trunk and enter spinal cord through upper four thoracic nerves. This is important. The pain varies considerably from severe crushing pain to nothing more than a mild discomfort. The pain is not felt in the heart but is referred to the skin area supplied by the corresponding spinal nerve. The pain are supplied by the upper fourth intercostal nerve. This is important, and by intercostobrachial nerve. T2 are therefore mainly affected. So medial side of arm में pain होगा, and in the skin region of the heart, which is supplied by the upper T4 intercostal nerves. Okay. So the next important clinical points are some important congenital defects of the heart and great vessels. Atrial septal defect. In 25% of individuals, the foramen ovale doesn't completely close. When the opening small, it has no clinical significance. Occasionally, however, the opening is large, and this results in oxygenated blood from the left atrium passing into right atrium. The atrial septal defect. Ventricular septal defect. The ventricular septum is normally formed by fusion of small membranous upper part with the larger lower muscular part. Ventricular septal defects occur in the membranous, which is the upper part of the membranous part of the septum. Oxygenated blood passes through defect from left to right, causing enlargement of the right ventricle. ये हो गया ventricular septal defect. Then the next is tetralogy of Fallot. The following 4 defects occur with tetralogy of Fallot: large ventricular septal defect, stenosis of pulmonary trunk, large ventricular septal defect, stenosis of the pulmonary trunk, exit of the aorta from the heart immediately above the ventricular, overriding aorta. Exit of the aorta from heart immediately above the ventricular septal defect. Hypertrophy of the right ventricle because of the resulting high blood pressure in that ventricle. क्या 4 फीचर्स होंगे? Large ventricular septal defect, stenosis of the pulmonary trunk, exit of the aorta from the heart immediately above ventricular septal defect, hypertrophy of the right ventricle because of the resulting high blood pressure in that ventricle. There is a large ventricular septal defect, so the blood from the left is going to right, and आगे pulmonary aorta pulmonary trunk भी stenosis, so and overriding aorta, so there is hypertrophy of the right ventricle. Next is patent ductus arteriosus. Normally, the ductus arteriosus has closed by the end of first month after. This is important. Normally, the ductus arteriosus, you know what is ductus arteriosus? The connection between aorta and the pulmonary trunk before birth present. So, the ductus arteriosus has closed by the end of first month after birth. Closed by the end of first month after birth. Failure of the ductus arteriosus to close results in aortic blood passing into the pulmonary artery, which then raises the pressure in the pulmonary circulation and causes hypertrophy of the right ventricle. Hypertrophy of the right ventricle. Okay, the next is coarctation of aorta. Coarctation of aorta is a narrowing of the aorta, just proximal opposite or distal to the site of attachment of ligamentum arteriosum. It arises after birth, and it is thought to result from contraction of ductus arteriosus muscle tissue that has been incorporated in the wall of the aorta. When the ductus arteriosus contracts normally, the aortic wall also contracts, and the aortic lumen narrows. Later fibrosis causes permanent narrowing. It arises after birth and it is thought to result from contraction of ductus arteriosus muscle tissue that has been incorporated in the wall of the aorta. When the ductus arteriosus contracts normally, the aortic valve also contracts, so the aortic lumen narrows. Later fibrosis causes permanent narrowing. So this causes coarctation of aorta. Okay, so the next point, clinical point is here it is. Azygous vein and cava obstruction. In obstruction of superior or inferior vena cava, the zygous vein provide an alternative pathway for the return of venous blood. In obstruction of the superior or inferior vena cava, the zygous vein provide an alternative pathway for the return of venous blood to the right atrium of the heart. Okay. So जाते जाते इस thorax में इस डायग्राम को भी देख लें. This is important. This is also important. This whole area, just see, this whole area is supplied by your thoracic duct, and this small area is supplied by right lymphatic duct. Just see it, get some idea. This is parasympathetic. These ciliary ganglia contain, we know, parasympathetic system 3, 7, 9, 10. 3 through ciliary ganglia supplied eye. 7 is further divided into 2, and in the first ganglia which is just showing is here. It is pterygopalatine ganglia which supplies lacrimal, and the other one is submandibular ganglia which supply submandibular sublingual salivary glands. And the ninth nerve, parasympathetic ganglia, is otic ganglia which supply parotid gland. This is important. Parotid gland is not supplied by submandibular, is not supplied by seventh nerve. It is supplied by ninth. It is supplied by ninth glossopharyngeal nerve. ठीक है, parasympathetic supply की बात करें. And the fourth vagus nerve is supplied all of the organ like heart. Parasympathetic supply lungs, stomach, small intestines, large intestine. Okay. Okay, and this is your sympathetic system, thoracolumbar T1 to L3, L2, celiac ganglion, superior mesenteric, renal ganglion. And this is your craniosacral parasympathetic S.